St. Mary's is a Kenyan Christian community focused on medical ministry in service to lower income Kenyans. St. Mary's Mission Hospital is a new way, a new model of being involved in medical ministry that's locally appropriate and more contemporary in that it's based upon bringing together bright young Kenyan talent. Medical ministry is as important and relevant today as it's ever been, proclaiming the gospel, good news of God's love for each one of us. Using medical ministry has been a tradition throughout the history of the Christian church. Here, for example, in East Africa, there were many religious missionary sisters, brothers, what have you, who came from Europe and set up hospitals and were wonderful at providing medical ministry to especially lower income persons. There were very few local medically trained personnel, and that model was fine for that point in history. As time went on, today we have many, many bright young Kenyan doctors, nurses, medical personnel. The idea that they will spend their careers working for someone else, no, those days are gone. Today, you have to give people ownership of their labor. So instead of having people work for St. Mary's, we've been fortunate in recruiting people, bringing them in, inviting them to become part of the mission vision. These people are St. Mary's. So we spent a great deal of time thinking through this new approach that was sustainable, locally appropriate, and affordable to lower income persons. And that is one of the striking things about St. Mary's. It is a mission hospital, yes, but it's a new way of being involved, of delivering medical ministry.
The idea to start St. Mary's was to to make sure those patients living in the slums, especially around St. Mary's, can access affordable medical care.
St. Mary's Mission Hospital began in Nairobi, adjacent to one of the world's largest slums. This was our target population. We wanted to be close and accessible to them.
We wanted to create an affordable environment for the low-income patients, because many people are not able to meet the cost of the major hospitals in the private ones.
Coming in, what I liked was the whole idea that the hospital was being set up to be run by young, passionate Kenyan doctors, so that we take care of low-income people. And taking care of low-income people has always been my passion. That's what drove me into medicine.
When we started our hospital, the charges were so few, and we were targeting the most poor person who can come and get benefit from St. Mary's, because you see our charges, even the most poor person can really afford.
So the rationale was, what is your goal in this particular situation? How do you accomplish that goal in a cost-effective, locally appropriate situation? It sounds simple, but it means going back to each and every step, from infection control, how we do a particular surgery, you name it, in a way that's not wasting patients' money, but is getting the goal accomplished in an efficient, competent, affordable manner. By doing that, I think we've attracted quite a number of patients. From the first day we opened, I think we saw 15 patients. We put a lot of our faith that if we're doing a good job for people, that they will, by word of mouth, tell others, and that indeed is how it's happened. We've had a phenomenal growth. Today, our initial hospital in St. Mary's, Nairobi, is seeing about 1,000 patients each day, each and every day. It's one thing to see 1,000 patients in one day, but to do that day after day after day takes a lot of coordination, a lot of goodwill, a lot of hard work. And I think our Kenyan personnel, who are part of the St. Mary's team, have proven themselves over and over that they're up to the task. For example, our dental clinic, by doing things well in a cost-effective way, has grown to become the largest dental practice in East Africa. The same story over and over again. We deliver about 8,000 to 10,000 babies a year. That's a lot of babies. With the numbers in Nairobi reaching about 1,000 outpatients a day, 300 to 350 inpatients a day, it was obvious that rather than expand that one facility, it would be better to create a second St. Mary's so that the staff community remains sharply focused and united. So 6 years after we opened the initial hospital in Lang'ata, a local Kenyan businessman approached us and offered us land in the Rift Valley on a beautiful setting adjacent to Lake Elementaita to create another St. Mary's Hospital.
I think our hospitality really moved so many patients towards us, and we really loved to work with them, and they could appreciate us. And up to today, the St. Mary's Nairobi has given birth to St. Mary's Rift Valley.
So again, here we have international donors donating funds for construction, a local businessman donating the land to create the hospital upon, and hiring, forming, orienting more bright young Kenyans to become the staff of this second St. Mary's. So the model is continuing in that light.